The muscle of the week is the trapezius. The upper section of the trapezius originates from the occipital bone and the C1 to C5 spinous processes and inserts on the lateral one-third of the clavicle. The middle section originates from the C6 to C7 and T1 to T5 spinous processes and inserts on the acromion. The lower section originates from the T6 to T12 spinous processes and inserts on the scapular spine. The upper section of the trapezius elevates the scapula, the lower section depresses, and the middle section retracts. Given this, exercises like shrugs and upright rows help build upper trapezius muscle. You can train the middle and lower trapezius with rows, deadlifts, and pull-ups. In fact, the upper trapezius is one of the areas where it's hard to build muscle mass. If someone's upper trapezius is overdeveloped to a point where their neckline is barely visible, then they must have used steroids. The muscle of the week is the latissimus dorsi. As one of the three largest muscles in our body, the latissimus dorsi originates from the T7 to L5 spinous processes, posterior iliac crest, and posterior sacrum, and inserts on the floor of the intertubercular groove of the humerus. The main functions of the latissimus dorsi include extension, adduction, and internal rotation of the shoulder joint. Given this, vertical traction exercises such as pull-downs and pull-ups, horizontal traction exercises such as bent-over rows and T-bar rows, shoulder extension exercises such as straight-arm lat pull-downs and pullovers, and even deadlifts can help develop the latissimus dorsi. The latissimus dorsi is very important in building the V-taper physique. However, only training the latissimus dorsi will not actually make your shoulders wider. It just make them look wider visually. The muscle of the week is the Erector spinae. The Erector spinae is made up of three parts: spinalis, longissimus, and iliacostalis. The spinalis runs along the spine's spinous processes, supporting posture and movement. The longissimus spans from the sacrum to the skull, attaching to the vertebrae and mastoid process. The iliacostalis connects the pelvis, ribs, and cervical vertebrae. Located along the spine, the Erector spinae plays a vital role in keeping it upright. It supports spinal extension, lateral bending, and rotation, making it essential for posture and movement. To strengthen this muscle group, try exercises like deadlifts, back extensions, the Superman pose, or bird dog stretches. The Erector spinae works as the antagonist to your abs. If it's weak, it can lead to back injuries during core workouts. So, training this muscle isn't just good for your back, it's also crucial for a stronger, more balanced core. The muscle of the week are the rhomboids. The rhomboid major originates from the T2 to T5 spinous processes and inserts on the medial border of the scapula. Similarly, the rhomboid minor originates from the C7 and T1 spinous processes and inserts on the medial border of the scapula. The primary functions of the rhomboid muscles include retraction and downward rotation of the scapula. Additionally, they act as stabilizer muscles, keeping the scapula fixed to the thorax. Exercises involving scapular retraction, such as scapular squeezes, YWT exercises, wall slides, and rows, are beneficial for strengthening the rhomboid muscles. You can stretch your rhomboids with shoulder horizontal adduction stretches and rhomboid dorsi stretches. Prolonged sitting often causes the scapulae to shift forward, stretching the rhomboid muscles and weakening their tension, which can lead to upper back pain. If your upper back feels stiff or uncomfortable, performing rhomboid stretches is highly recommended.